In the wake of Guyana confirming its first case of COVID-19, a global health threat which has taken several countries by storm, Chief Executive Officer of the Georgetown Public Hospital Corporation, George Lewis, is urging persons to maintain a sense of calm, even as health officials work assiduously to contain the disease and protect the Guyanese populace. He told Nightly News that while the passing of a patient at the institution has understandably fueled fear and anxiety among many persons regarding visiting the medical facility, he assured that the necessary precautionary measures have been undertaken to ensure the environment is safe. Nightly News understands that some 14 employees who came into contact with the COVID-19 patient are now under quarantine. However, the chief executive officer said that with the reshuffling of staff, the hospital is still equipped with the requisite human resources to attend to persons who visit the hospital for all forms of ailments. Meanwhile, the Ministry of Public Health has advised persons not to go to the hospital if they are experiencing symptoms of coronavirus, but should instead call the hotline numbers on 227-4986 or 624-3067 to be guided on further steps to be taken. On Thursday, several persons in Georgetown were seen wearing gloves and surgical face masks as preventative measures. Deputy Chief Medical Officer Dr. Karen Boyle, while echoing calls for persons to remain calm, advised on the correct type of masks to be used.
What is important for you to recognize is that the surgical mask was originally used to prevent contamination of or spread of droplets and infection from the person using it to those or a surgical platform in front of them or for persons around them. The N95 mask is the kind of mask that would help prevent you from becoming infected, as against the surgical mask, which is more to prevent you spreading infection to others.
On Wednesday, the remains of a 52-year-old East Coast Demerara woman tested positive for COVID-19 at the Georgetown Hospital. The woman is said to have traveled to Guyana from the United States of America on March 5. According to the Public Health Ministry, the woman, who was suffering from underlying health conditions such as diabetes and hypertension, died at 8 a.m. at a medical institution. Following her passing, samples were taken to the National Reference Laboratory, where the diagnosis was classified as an imported case of COVID-19. The death toll for the virus in the last 24 hours has jumped to 4,947. Cuba and St. Vincent and the Grenadines confirmed cases earlier on Thursday. COVID-19 is now affecting approximately 125 countries globally. Tamika Rodney reporting for HGP Nightly News.